Hello and welcome. I'm Ashley Hawes, Director of Consumer Information at Benjamin Rose Institute on Aging. Thank you for joining us today for a conversation on the White House Conference on Hunger, Nutrition, and Health, presented in partnership with the Elder Justice Coalition. This webinar will be recorded. You may submit a question at any time using the Q&A or chat feature at the bottom of your screen. We have staff monitoring to convey your questions to our presenters and to answer any technical questions you may have. You can turn on captions by selecting Live Transcript, the button with two C's at the bottom of your screen. I will now turn it over to Orion Bell, Benjamin Rose President and CEO, who will introduce our speaker. Orion?
Great. Thank you. Well, thanks, Ashley. To start things off, I would like to thank Bob Blancato and Meredith Ponder-Whitmire and the Elder Justice Coalition for their continued support in making this webinar possible. Today, we have the pleasure of hearing from Bob to give us a perspective on the implications from the recent White House Conference on Hunger, Nutrition, and Health. Bob is the president of Matz Blancato and Associates, and in that capacity, he serves as the national coordinator of the bipartisan 3,000-member Elder Justice Coalition, and is the executive director of the National Association of Nutrition and Aging Service Programs, or NANASP, and is the national coordinator of the Defeat Malnutrition Today Coalition. I will now turn it over to Bob to get us started. Thanks, Bob.
Thank you, Orion. Appreciate the introduction and the partnership with Benjamin Rose Institute on Aging for this webinar and many other things. And yes, I'm delighted to be joined today by my colleague Meredith Ponder-Whitmire. And yeah, we're going to talk about this White House conference, which was held at the end of September of this year. You know, it was an event where many food and nutrition experts and advocates were there, but the people who really made the difference in terms of impact were those with lived experience who came and told their story about being food insecure or going through hunger or going through poverty or access, limited access to food, and how the intervention of certain federal programs helped change their life. And it was very significant to watch that. And you know, I was there, and it was about 500 of my closest friends in the same place. And President Biden gave a very powerful speech that day to the assembled group. Somebody cannot hear the speaker. Okay. I don't know what to do about that, actually.
I don't think it's on your end, Bob.
Okay. Okay, great. So the president came and spoke, and a number of other folks came. And the thing that was really interesting was how there were more than $8 billion in commitments from the private sector that were made in conjunction with the conference. $2.5 billion invested in startup companies that are pioneering solutions to hunger and food insecurity. Over $4 billion dedicated toward philanthropy that improves access to nutritious foods, promote healthy choices, and increases physical activity. I'll give you a couple of examples. Chobani, the yogurt company, launched a national corporate responsibility initiative called Food Access in Reach to encourage businesses of all sizes to adopt a school and pledge to make it food and nutritious secure. DoorDash was going to partner with 18 different cities across the country to champion state and local policies that can support farmers in combating food insecurity. And then Publix, the large supermarket chain, committing to donating $3.8 million to 22 Feeding America food banks to establish free mobile food pantries for stocking local fruits and vegetables. These are just small examples of these $8 billion in commitments that were made in conjunction with the conference. So this conference actually was the first one of its kind held since 1969, which is kind of hard to believe how much has changed in that whole space of hunger, nutrition, and health since then. The 1969 conference did produce the WIC program and the SNAP or food stamp programs. So what was the goal of this conference? To develop a roadmap to end hunger and diet-related disease and improve nutrition by 2030. We'll go to the next slide, and let me thank Sarah for helping with moving these slides along. We appreciate that. So the actions of this White House conference were built around 5 pillars, and I want to go through them all, because they're all important and all interconnected. Improving food access and affordability. Integrating nutrition and health, which, you know, for those of you on this webinar It may sound odd that people are just beginning to understand the connection between nutrition and health. It's been there forever. It's just now it's finally being recognized as an important element in improving health, particularly for older adults. The third pillar is to empower all consumers to make and have access to healthy choices. Number 4, to support physical activity for all as a connected piece to good health and good nutrition. And finally, number 5, to enhance nutrition and food security research. Now, if you were to sort of break this down a little bit, the one common theme that you would hear in this conference and since the conference is we need to rearrange the pricing structure of food in this country. It is too easy and too cheap to get bad food, whereas you have more of a challenge to pay for good quality food. And the goal is to change that around so that we're offering more better choices to people at all levels. But as we say at the bottom, having gone through 6 White House conferences of my own in my lifetime, you have a wonderful day, you have a wonderful conference, everybody gets all excited and everything else, but what do you do afterwards? How do you really take what's been put forward and go forward? So to go to the next slide, let's talk specifically about the aging-related provisions that were put forward in the White House conference. Starting with one that's very current and very important as we speak, increasing funding for the Older Americans Act nutrition programs. For those of you familiar with those programs, this year is their 50th anniversary of the Older Americans Act nutrition program. And many of you know that went through a major transformation during the pandemic. One day you had meals being provided in senior centers, adult daycare facilities, congregate sites. The next day they were closed and they had to find ways to still feed those individuals in their homes. And that transformation was significant, and it led to Congress approving $1.6 billion in funding for the Older Americans Act nutrition programs during the pandemic. That was twice their funding level that they had received before the pandemic. But now you're faced with a crisis about how much of that money can you retain going forward? How do you avoid a service cliff that happens if your funding doesn't maintain itself as your demand increased and your cost increased? So making increased funding for the Older Americans Act as one of the key aging provisions was very important for this White House conference. The second is universal screening for food insecurity in all federal healthcare systems. Very important fact that the federal government's got to take the lead when it comes to a variety of things like screening. But this also calls for incentivizing other payers and providers to screen for food insecurity and other social determinants of health, including malnutrition, as Orion mentioned before. The next one, leveraging federal nutrition programs to promote healthy habits and nutrition education. This is a constant theme. The federal government's got to take the lead. They have to show the way, okay? Federal dollars spent on food should provide healthy choices of food. And we should be doing more in the nutrition education space for people to know what to do when they're not at a program, when they don't get their lunch, after they finish their lunch at a congregate nutrition site, but they want to maintain good eating habits, they need to have good nutrition education. We do not have sufficient funding for nutrition education right now. Same thing with expanding access to nutrition counseling, medical nutrition therapy. It's limited to who gets it. We need to expand that. Also, regular updates to the dietary guidelines for Americans with, again, detailed national nutrition education campaigns. These dietary guidelines are updated every 5 years. And the next update is supposed to give a special focus on the nutrition needs of older adults. And those of us in this space will be doing a lot of advocacy with the people developing these guidelines to make sure that's done. Another provision, and this one was a surprise to a lot of us that it even existed in the law. There's a current law that inhibits SNAP retailers from stocking healthy foods as a requirement for participation in the SNAP program. It seems to us that we ought to be repealing that law and encouraging SNAP retailers to stock healthy foods as a condition for being in the SNAP program. And then finally, the last provision is the creation of an aging and nutrition research agenda within the Administration for Community Living. Now, this will be important because this will be an agenda that's made up by folks who work in the government, but also external partners. Those of us who work in the nutrition space will be invited to be part of this research agenda and help shape the research agenda. So next slide. So as I said, it's what you do after these conferences that's important. So let's talk about what's happened since the conference and on a short-term basis. Okay, the White House and the Centers for Medicare and Medicaid Services announced a food as medicine pilot program to allow initial coverage of medically tailored meals under Medicare, something that's been advocated for some time. The Department of Agriculture held a national summit on nutrition security and healthcare, where I attended, as did my colleague Meredith. And it basically built off of one of the major outcomes of the White House conference to formalize and advance the link between nutrition and health. The Senate Committee on Agriculture had a hearing just this week, led by Senator Cory Booker, who was one of the 4 main players in Congress to create the White House conference. And here again, his focus is on food as medicine. What are the current efforts being done, and what are the potential opportunities for expansion of those food as medicine programs? And just within minutes ago, a hearing held by the Senate Special Committee on Aging, led by Senator Bob Casey of Pennsylvania, they just concluded a hearing called Setting the Table, Promoting Healthy and Affordable Food for Older Adults. And in that hearing, Senator Casey talked about bills he's introduced that would create an older adult hunger nutrition task force within the government, and to authorize funding for research into older adult hunger and nutrition for the Administration for Community Living. So these are all short-term outcomes, if you will, and follow-ups to the White House conference. And then if you go to the next slide, we'll talk about longer-term activities that'll happen. Okay, we have a new Congress that'll start in January. Okay, actually, we could modify that first bullet because there was a runoff in Georgia that made the majority 51 to 49 for the Senate. There's a little caveat with that, but it'll take too long to explain the decision by Senator Sinema to become an independent. But the Democrats retain majority in the Senate. Senator Debbie Stabenow of Michigan will remain the chairman of the Senate Agriculture Committee. Senator Murray of Washington State will be the chair of the Appropriations Committee, and Senator Casey will continue as chairman of the Senate Aging Committee. And Congressman Thompson of Pennsylvania will be the new chair of the House Agriculture Committee, and Congresswoman Granger from Texas, the new chair of the House Appropriations Committee. So next slide. Another long-term outcome, if you will, follow-up to the White House conference will be the Farm Bill, the reauthorization of the Farm Bill. And people say the Farm Bill, isn't that all about farming and that kind of stuff? No, 80% of the funding in the Farm Bill goes to domestic nutrition programs, like the SNAP program, the Commodity Supplemental Food Program, the Senior Farmers Market Program, the Emergency Food Assistance Child and Adult Daycare Food Program. These are all in the Farm Bill. And the reauthorization, for those of you not familiar with that term, is when you take a law and extend it for a period of time, 3, 4, 5 years, and modernize it to meet its current needs and current changes. This reauthorization could be a key implementer of the ideas that came from the White House conference and the policy proposals that came from the White House conference, including increases to SNAP allotments, that changing that law I mentioned earlier that inhibits SNAP retailers from stocking healthy foods, and increasing funding for these programs. But this next point is very important. For those of you who are interested in doing advocacy around any of these topics, particularly the Farm Bill, Senator Sherrod Brown is on the Agriculture Committee, a senior member of the Agriculture Committee, and should be contacted early in 2023 with some of your own ideas about what you could see the Farm Bill doing in Ohio to help older adults in their areas of nutrition. Next slide. Another long-term outcome from the White House conference will be reforms that will be made to Medicare. Okay. Now, we have seen in the course of this year some dramatic changes to the Medicare program. For the first time, we have the ability of the government to negotiate prices for drugs under Medicare Part D. There's now a cap of $35 on how much a Medicare person would have to pay for insulin. And you now have new dental and mental health rules. For example, you could now have dental coverage under Medicare if it's tied to a medical condition, avoiding infection, things of that nature. Because we know that poor oral health is a giant risk factor for poor nutrition and malnutrition. And the door is now open for the ability to have Medicare begin to cover the things that people have wanted it to cover for a long time, starting with dental, and hopefully followed by hearing and vision. Another outcome we expect is expanded Medicare coverage of medical nutrition therapy. At the moment, Medicare only covers this kind of counseling for people with kidney disease, transplant, and diabetes, but people with many other conditions would also benefit from medical nutrition therapy that should be viewed as a preventative benefit, which is what Medicare is doing more and more of in the years right now. And we're hoping to have it be part of the Medical Nutrition Therapy Act and the Health Equity and Accountability Act of 2022, which is still technically pending in this Congress before it wraps up for the year. Next slide. Let's also, again, go back to the medically tailored meals point, because this may be the most visible outcome of this White House conference. Okay, having possible Medicaid coverage of medically tailored meals. 2 states, Oregon and Massachusetts, submitted waiver requests with pilots to do just that, and they were approved by the Biden administration. And, you know, we can also have expansion of food as medicine programs when you consider that over 800 Medicare Advantage programs cover meals, food, and/or produce, and that healthcare organizations are starting to prescribe food. They have, you know, produce prescription plans, things of that nature. And so the more Medicare Advantage goes into the space, the more the pressure will be to have fee-for-service Medicare do the same kind of coverage. So how that plays out could be very important in the years ahead. And it is an outgrowth of this White House conference. Next slide. Another outcome, if you will, goes back to a report that was done 3 years ago where there hasn't been enough movement actually on it. So what this Government Accountability Office report talked about was the need to improve the quality of food provided with federal dollars for older adult nutrition programs. And we need to have this report implemented better. And the White House conference really supports a lot of what the Government Accountability Office said in that report. So as I mentioned, they want to see the dietary guidelines really address the unique nutritional needs of older adults. But they're a little critical of the fact that the process is taking off very slowly. And they were critical back in 2019, and the process is still going off a little bit slowly. And I suspect there will be a little pressure put on the Department of Health and Human Services to pick up the pace on the next dietary guideline rules. And then a basic thing, which is that we should ensure that meals meet federal nutrition requirements in all of these federally funded nutrition programs, congregate home delivered meals, the CACFP programs, things of that nature. But this is a report that's already been done. It just needs to get implemented, and this work will be accelerated next year. Next slide. So going back again to the national strategy from the White House conference that it included older adult issues. You know, the Older Americans Act is still the largest, the federal nutrition program is the largest program in the Older Americans Act, yet it still has ongoing funding challenges, okay? Because again, as I mentioned, the pandemic created a whole new demand for service from the Older Americans Act. In fact, if you were an individual who was remaining at home, sheltering at home because of a state or local ordinance, you were eligible for a homebound meal, which expanded the roles of the Older Americans Act Nutrition Fund considerably, okay? And that, you know, that increased demand. And then you factor in inflation. Inflation hitting food prices and hitting gasoline prices, 2 things critical to the Older Americans Act Nutrition Program. The impact of inflation has been devastating for a lot of these programs. So funding is a challenge for this fiscal year and next as well. And then, of course, oversight of all major nutrition programs in the post-pandemic period and after the public health emergency is lifted sometime next year. We want to find out what was successful. What did people do? You know, people were remarkable on the ground, everywhere from Cleveland across the country. Anybody providing nutrition services had to pivot and change their whole structure without a game plan. Okay, the pandemic came along. There was no game book for that. All of a sudden, boom, you have to change everything around. Well, people started all kinds of innovations, from restaurant partnerships to grab and go meals. Grab and go have become very popular right now in many places. And the question is, how do you continue the ones that have worked after the public health emergency? Well, the answer is you write it into a law, but also you have to have the funding to keep it going. So that's why these whole issues around funding are so important. So let's go back to a current situation. Next slide, please. So going to right now, the fiscal year 2023, which we are now in, it began October 1st. Okay. Now I gave you a number that said, you know, 1.6 billion that was provided in the pandemic bills. Well, now we're back to regular appropriations. And as you can see, the funding level for nutrition outside the pandemic dollars was $966 million, which is the current level that they're funded at right now. Okay, the president asked for $1.2 billion in funding. The House has asked for $1.26 billion, and the Senate has so far has only asked for $1.03 billion. Okay, and as this chart shows you, it's broken down by congregate, home delivered, and the NSIP program. Well, as I mentioned, you know, the realities are added demand and inflation, you know, mandate a generous funding level for the nutrition programs. So what NANASP and Meals on Wheels America are asking for is a doubling of the funding to get that number up from 1.2 billion to 1.93 billion dollars. And where does that stand right now? Well, as I mentioned earlier, we are right now in Washington dealing with a continuing resolution, which means you are funded at the first level that you see on this chart, the FY22 level for these programs. Funding for the federal government runs out at midnight tomorrow night, unless Congress passes an extension, which they're expected to do. The Senate is supposed to join the House today and pass a 1-week extension to keep the government open through next Friday. But where the ability to get any increase comes is if you pass what's called an omnibus appropriation bill. Okay, that's where you can have increases. And so we are working double time at this point to get language into that appropriation omnibus bill to get as much money as possible, not only for the nutrition program, but also the home and community-based services program of the Older Americans Act. But this was, again, this was a major recommendation of the White House conference. So we want to see it happen sooner rather than later. So next slide. So, you know, in closing, you know, we greatly appreciate the interest of the Benjamin Rose in the White House conference. Ori and I had many discussions about the conference, both before and after, but also the work you and your colleagues do every day in providing nutrition services to older adults in Cleveland. You know, and this is where the work gets done. This is where we make changes that impact policy. But this is also where advocacy is very important. You know, it makes no sense for people in Washington to write laws if they don't know what the impact is at the local level. And that's where you come in, by communicating with your elected people on what changes should be made, what improvements could be made. You know, and this White House conference, like many White House conferences on aging and others, always propose lofty goals. But the question is, if you start working on it early and you get everybody involved, you could make an impact. But you need to start early, because many of the ideas and the proposals that I talked about are going to require action from Congress. And, you know, this is the time to start thinking about post-conference advocacy. And we are more than happy to assist you in any way to help you understand how to do better advocacy, what tools to use. And on that note, the next and last slide here are some specific advocacy links. If you want to support more funding for the Older Americans Act Nutrition Program, you look at that QR code and nanasp.org at Take Action, okay? And you can use it, you know, right now, and you can have these slides can be available. And you can use it after the webinar. And if you want to learn more about the White House conference beyond what I covered, go to that QR code and get get more information about the White House conference. And I'll close with, on the next slide, and we'll leave this slide up to see if folks have questions, is a resource page. Okay, so we're going to leave this up for you to look at, jot down, take a picture of, whatever you want to do. But with that, I think Ashley and Orion, I'll stop and see if folks have questions. But thank you for the chance to come and make this presentation. And I should ask Meredith, is there any additional comments you want to make on our behalf?
No, I think you covered it really well. Thank you.
Well, I passed the test, Orion. Here we go.
Thank you, Bob. So we do have time for a few questions. Just a reminder, if you could submit your questions using the Q&A feature at the bottom of your screen. So we had a question come in, Bob, that said, was funding discussed for medically tailored meals specifically?
The answer is yes. Discussed in the context of how to get more funding into those programs. Okay, the idea of having Medicare cover medically tailored meals is a goal that's been there for a number of years. And now they've begun the process on a limited basis with a recent announcement that they made. But the hope is that as the new Congress starts next year, not only will Medicare cover and reimburse for medically tailored meals, but Medicaid as well, recognizing, of course, that Medicare Advantage already covers some aspects of medically tailored meals. But there is and I wouldn't be surprised actually if the Farm Bill finds a way to also address funding for medically tailored meals. I think of all the things that have came out of this conference, that one seems to have the most support, the most interest. And again, it's the one that's mostly connected the relationship between nutrition and health. You know, a medically tailored meal is what it says. It is tailored to help you improve your health. And it only makes sense that if you have a program like Medicare and Medicaid, you know, the federal dollars should be used effectively in a preventative way to help people improve their health. And I'll ask Meredith if she has any other insights about medically tailored meals.
No, again, I that would have basically been the answer I would have given. So thank you.
Okay. All right. Ashley, any other? How could we?
Yeah, Bob, were there any specific discussions or outcomes either at the conference or in the Farm Bill to make nutritious food more affordable?
Well, there was plenty of talk about it at the White House conference, and I suspect that it's, you know, it's a tricky issue in many ways. You know, you've got to some degree, you've got to find incentives to make the private sector change their food pricing policies. Okay, you know, you can wish a lot of things, but you know, how do you go from wish to actually making it happen? I think what you're going to see is a sort of a commitment, perhaps starting with addressing the food desert issue. Okay. Now, when you have a food desert, that means you're lacking a large supermarket or something of that kind that has a wide choice of foods. If you're in a food desert, you're often relying on convenience stores, which tend to have a tendency to stock, you know, not nutritious foods. So what I think you're going to see is some efforts being made concentrated first in the food desert area to provide incentives for those convenience stores and those stores to provide better quality, healthier foods. And if you provide incentives, then you get response. And what I mean by incentives, whether it's providing tax breaks or something along those lines, but the message has got to continue to be at the highest levels of government that our current food pricing structure is wrong. Okay, it is wrong, not for people to be able to afford the kind of food that will make them maintain their health. Okay, I mean, we have a wonderful program. I know you're involved in that program, the Senior Farmers Market Program. Here's a program that was started back in 2000, I think it was. And it had as a simple goal to allow low-income older adults access to fresh fruits and vegetables at a market. And it did two things. One, it helped low-income people get access to fresh fruits and vegetables. But number two, it opened up a new market for small farmers to sell their products. We need more of that kind of innovation, if you will, even though it doesn't sound terribly innovative, it really was at the time. So yes, plenty of discussion, but now you've got to transform that discussion into some tangible actions. And I think the first place you're going to see it is in the food desert space.
Okay, great. And Meredith, did you have anything to add to Bob's response?
I don't actually think so. I'm sorry. I'm not very eloquent today or providing additional information, but I don't have much to
Oh,
provide.
all right, here's what we're going to do, Meredith. The next question, we're going to start with you. How's that?
Oh, okay.
All right, so we did have a question come in asking, how can we make DC a test site to solve food insecurity for seniors since it's #1 in the nation? This is such a small area, and if we were successful, we could duplicate the business model. And they were also wanting to know what state has been very successful.
Okay, so you had to give me the very difficult question, Bob. Thank you. That is especially asking about what states have been very successful. That's a tough one because it really depends on what sort of food insecurity we're talking about. If you're talking about people not being able to afford food versus people not having access to food, like food deserts, those are two very different problems. But in general, I would say that you could make DC a test site by potentially doing some of the things that were talked about via a Medicaid waiver, for example. I know that, with the Food is Medicine pilots, those are being accomplished through Medicaid waivers. There's also, there's, of course, because DC is a small area, it's possible that additional funding could be found. I know that, there's definitely ways that DC could provide further incentives like farmers market programs, et cetera. As to finding a comparison state, especially if we're talking about malnutrition, but also thinking about some of these other aspects, Massachusetts has been very successful on the nutrition front. Bob, I'm not sure if you have any other thoughts on states, but
Yeah.
I think Massachusetts is actually a really good example of a state that has taken a few different tactics on this front.
And so has your home state of Ohio. They have a malnutrition commission. They've done great work. They've come up with some good ideas. And I think the answer really is a lot of times when it comes to DC, because DC is not technically represented in Congress. The person who represents DC does not have a vote, okay, which is another issue in itself. Statehood for DC, which always comes up as an issue. But if you can pick up a couple of champions, many of the members of Congress live in DC, okay, and that the individual who asked the question is right. It is #1 in the nation for food insecurity, but it's broken down like too many areas in this country by something like what side of the river are you on, okay? And that's kind of where the focus needs to be, okay? And I'm pretty sure that there are some demonstration grant opportunities that DC could file for to address this. And I think they'll be smart enough to work with the champions of the White House Conference to try to get something built into the upcoming Farm Bill or Appropriation Bill to increase their ability to address food insecurity. So I think that's going to happen. That statistic was very big, very publicized in this town.
I would also add, thinking about demonstration grants, ACL currently has the nutrition innovation grants open right now, including a grant for local organizations to partner with research institutions. So that's, especially because DC is a smaller space, that might be something to consider, grouping together and finding a local university to work with on that.
Okay, great. We had a question asking about the Senior Farmers Market Nutrition Program. They said, could we use this as an opportunity to tie the benefit level to the actual cost of consuming the recommended number of fruits and vegetables? They said currently the maximum benefit level is $50 for the entire season, and it costs about $125 per month to eat 8 servings of fruit and vegetables per day.
Sounds like an RD asked that question, or somebody deeply steeped in nutrition. Thank you for that question. That's a great question, actually. And you know, the answer to that question is that's what advocacy as we approach the Farm Bill is all about. Okay, that very question should be converted into a communication to Senator Brown that says, as you approach your consideration of the Farm Bill next year, you know, we recommend that you make the necessary adjustment in the farmers market program so that it actually reflects the reality of cost. Because, you know, unless somebody presents something, you can't assume that, you know, members of Congress, even and their staff, know all these little details about what actual things actually cost on the ground. So I would highly recommend, and you got time to do this because it's an issue that'll come up all of next year, is convert that into a communication to the senator. Copy us on it too, so we can help push it in his direction. But it makes total sense to not have this be the disparity that you're talking about. So thank you for raising this. Great question. They've all been great questions, actually.
Yeah, that really is a great question. It kind of reminds me of, you know, with the SNAP benefits, comparing the Thrifty Food Plan, for example, you know, the amount of SNAP benefits you receive per how much healthy food actually costs. And I think there's definitely potentially some openness to revisiting this sort of thing, given, you know, the SNAP revisiting and pushing up the benefits so that they actually reflect what it costs to eat healthy food. So I think there is definitely potential for something like this. I agree with Bob. I don't think they know that members of Congress know that this is even an issue.
And Ashley, somebody just put in the chat that they'd like to get that statistic that you read again because they want to jot it down. And while you do that, the thought was also, you know, you could tie future increase in benefits in the SNAP program and other things. You could build incentives into the benefits if you can demonstrate that you use your SNAP benefit for the purpose of acquiring healthy food. That might even lead to an increased benefit for the individual. Okay, I think if we tracked what people do with the SNAP benefit, and if there is a moving people in the direction of going for better food, that should be rewarded, frankly, in how they get their benefits. So that's something we should also look at.
Bob, you want to talk a little bit about not just the levels of SNAP, but just sort of some of the adjustments or relaxation of the eligibility requirements for SNAP that took place during the emergency order, that's part of this conversation too, not just the dollar amount, but who has access to the SNAP benefit.
Well, I can defer to Meredith for sure, because she tracks that pretty closely. So can I turn to you, Meredith, on that one?
Sure. So are you asking about the increases in benefits during the pandemic, or what?
Yeah, because I think there was a combination that there was some increase in the benefit, but there was also some flexibility in the eligibility for the benefit that was in play there as well.
Yeah, so one of the things they did, I believe, during the pandemic that hadn't really been done before was the categorical eligibility expansion, meaning that if you're eligible for other benefits programs through the federal government, you were found to be eligible for SNAP as well, which makes sense because a lot of those programs have very similar income definitions and limits. So
Medicaid eligibility and SNAP eligibility are a good example of that.
Yes, exactly. So that's something I think we should look at continuing. Also, you know, that brings up the SNAP benefit cliff, you know, among many cliffs that we're looking at. When the public health emergency is over, SNAP benefits for everyone will be lowered. So that's very concerning, especially with folks who have gotten used to having more food, dollars, and hopefully been spending it on things that are potentially healthier. To not have those benefits anymore is going to be pretty devastating.
Or in that time that I got waiting for, as Meredith was giving a great answer, I dug up a book here that we got when we went to the USDA summit after the White House conference. And here's what they're saying, what they've done during the COVID-19 pandemic. We talked about increasing the SNAP maximum benefit for tens of millions of participants and providing emergency allotments that boosted benefits to the maximum amount for the household size, replacing lost school meals with the pandemic electronic benefits transfer program that provided families with $35 in grocery benefits per week per eligible child, rapidly expanding the ability of SNAP benefits to be used online from 5 states in March of 2020 to 49 states in August of 2022. And the number of approved retailers were expanded dramatically from 8 initially to 150 stores being able to use SNAP benefits online, offering free school meals to all children, offering flexibilities to make it easier for parents to get food for their children, such as the ability to pick up multiple meals from school or summer meal programs at one time. And then there's like 3 or 4 others that are important, including increasing funding for the Emergency Food Assistance Program and the Food Distribution Program on Indian reservations to allow more food to be provided for food banks and tribal communities. I will provide this information subsequent to the webinar and back to you guys so you can distribute it to the participants.
Great, thank you. I know that, at my child's school, it was definitely a relief for many families to be able to receive those meals for free.
Mm-hmm.
All right, so there is another question. Will there be a systematic approach to the pillars, or is it an all at once sort of plan, for example, addressing the food deserts first before nutritious food?
Right. Another good question. Well, first of all, the word systematic and Washington don't go along too well. They don't really connect very well. Washington is not a systematic place necessarily. It's a episodic place. It responds to things based on a variety of pressures and factors. So, the answer is the people associated with the White House conference, the people in Congress associated with the White House would like to have the pillars all approached, cross-cutting, if you will. But reality will dictate that certain ones will jump ahead of other ones, okay? Because things like a farm bill coming up may move, one pillar up ahead of another one. I think they will always try to connect them as much as possible, but it isn't necessarily, doesn't lend itself, because it's kind of like White House conferences in general are very aspirational in what they put out, okay? And then you got to put it to the test of the reality of what you can actually get done. So I would think that, pillars 1 and 2, are probably going to come out faster than maybe number 5 would. But I think they'll all be addressed, but it's just to be a question of, who goes first and who goes second or whatever. But they will stand on their own as being guidelines for improving nutrition policy.
Thank you. Meredith and Orion, did you have anything else to add?
No, I think Bob gave a great answer.
Thank you. So that was our last question. If there are any additional questions, if you go ahead and type them in the chat now or submit them to the Q&A. I'll take just a minute to wait on any additional questions that come in. But as a reminder, we will be sharing a link to the recording as well as the PowerPoints after the presentation. So everyone will have access to all of the information as well as this wonderful slide with all these great resources on it. Okay, so I did not receive any additional questions. So I want to thank you all for joining us today. thank you especially to our presenters for sharing such great information. In the chat, there is a link for a webinar evaluation that we hope you will complete. Your feedback is important to us as it helps us improve our programming. Your responses will be kept confidential and will not identify you in any way. We hope that you will plan to join us for future events that we hold next year. You can register for these events on our website, www.benrose.org. There you can also find more information about all of Benjamin Rose's research, services, and programs. Thank you, and we hope you have a great rest of your day.
Thank you, Ashley. Thank you, Arian. Thank you, Sarah.
Thanks.
Thank you.
Happy holidays, everybody, too.
Thank you.
Thank you, you too.